Dihydropyrimidine dehydrogenase enzyme is necessary to break down fluorouracil-based chemotherapy most often prescribed for colorectal cancer. When you lack this enzyme, you have DPD deficiency. My name is Karen, and I want to tell you how important it is to test for DPD deficiency before starting fluorouracil-based chemotherapy. My mother was not tested before fluorouracil chemotherapy was started, and it's also known as 5FU. She died a horrible death, a death that was preventable had her oncologist tested her for DPD deficiency. With DPD deficiency, your body cannot metabolize 5FU and get it out of your body, resulting in your healthy cells being destroyed. Unfortunately, in the United States, it's not standard of care to pretest because of what is considered the low number of people with DPD deficiency. However, about 5% of the population are DPD deficient. In the United States, we are desperately lagging behind other countries in personalized patient care and safety. Countries such as France, Germany, the UK, the Netherlands, and the European Medicines Agency, which is about 29 countries, all require or recommend pretesting for DPD before administering fluorouracil-based chemotherapy. A few hospitals in the US pretest because they have seen firsthand the tragedy that happens when one is not pretested. It's time for the NCCN and the FDA to take action and save lives of people like my mom who are DPD deficient and are not aware of it until it's too late. Pretesting should be standard of care. The human cost of not pretesting is too high.
Hello, my name is Joanne McIntyre. I live in Portland, Oregon, and I'm a member of the group Advocates for Universal DPD, DPYD Testing. Sadly, I became a member of this group having lost my husband to the effects of his chemotherapy, Xeloda, with a previously undiagnosed DPD enzyme deficiency. He started having side effects from the chemo only 9 days after starting it. The entire medical staff didn't recognize his symptoms as DPD enzyme deficiency toxicity. And by the time they realized that that is what he was suffering from, that 96-hour window for reversal of the toxicity with the antidote Vistagard had closed. And consequently, he died a terribly painful and tragic death. All very preventable with upfront testing. So I urge anyone who has seen this video to remember the story and to do whatever you can to advocate for upfront DPD testing prior to either prescribing this medication, any of the 5FUs, capecitabine, Xeloda. Please do your patients a favor. I know that the numbers are small for those who actually have the deficiency, but one death is too many deaths. And I just urge you to remember the story and be proactive and save lives. Thank you.
Hi, my name is Ken. I'd like to share an important message with you and with anyone that you may know who is preparing to undergo chemotherapy for head and neck, breast, or gastrointestinal cancers. Those cancers are typically treated with a form of chemotherapy using fluoropyrimidine-based drugs. Those drugs are popularly known as 5FU and Xeloda. Patients that are undergoing that form of chemotherapy need to ensure that they have a sufficient level of what is called the DPD enzyme in order to be able to metabolize the drug. If they don't have a sufficient level of that, then they are at risk of having the chemotherapy destroy the healthy cells just as it's destroying the cancerous cells. The only way to know for sure if you have this DPD deficiency is through pre-screening, which unfortunately is not offered unless you ask for it. So please be sure that you are asking for this. Now, how did I come to know this? Well, my first wife, Kath, she was age 60 in good health until she noticed that she had a swelling in a lymph node. Well, we soon discovered that she had borderline stage 3, stage 4 rectal cancer. We went to 3 different cancer centers looking for treatment options, and she was instructed in each case that her treatment should include surgery, radiation therapy, and chemotherapy, the order of which didn't matter. And we were told that the chemotherapy would be something that she wouldn't have to worry about losing her hair or anything, and that is in fact fairly well tolerated. So when she in fact chose to start with this chemotherapy in order to be able to reduce the swelling and prevent any further spreading of the cancer. Well, within a matter of days of her only treatment, she started to show signs that were troubling. They were dismissed by the oncologist when she called to report them. She did get some treatment for some mouth sores. At that following week, she lost her appetite. She became dehydrated, and she had a bad form of diarrhea. And then finally, within a week, she collapsed. I had to rush to the emergency room. It was there in the emergency room that I first heard the expression of a DPD deficiency. She was admitted to the hospital. She started to show signs of progress for a few days, but she had mucositis, which made it increasingly difficult for her to breathe. And in fact, that's later what she succumbed to, is because she had to be intubated, and her strength was zapped, and she just never recovered. And despite the doctor's expectation that she would walk out of the hospital at the end of all of this. So within 3 weeks, matter of time, she went from one single treatment to her death. We were outside of the window for any use of the antidote, which was only an orphan drug at that point in time. And so that never really came into play. When she passed away, her oncologist recorded the death on her death certificate as being the result of her cancer. He later agreed to amend that upon my insistence that the cause of death was her toxic reaction to 5-FU, as well as her form of cancer. As I indicated before, people are going to be unaware that they have this deficiency, and they therefore should seek to be pre-screened before the start of treatment. DPD deficiency affects at least 3 to 8% of the US population. And I hope that you will take the time to let your friends and family members know, if they are preparing for chemotherapy for these forms of cancer, that they have this discussion with their oncologist and insist upon pre-screening. Thank you for your time.